Hello, my name is Patrick Blevins, and today I will be discussing the 5 reasons that I found behind vaccine hesitancy. Um, so I just went online and did some research, and these are probably the 5 most recurring themes that I've found when I was doing this research. So, kind of just a little overview. A vaccine is a substance used to stimulate the production of antibodies and provide immunity against one or several diseases prepared from the causative agent of a disease, its products, or a synthetic substitute treated to act as an antigen without inducing the disease. Despite being recognized as one of the most successful public health measures, vaccination is perceived as an unsafe and unnecessary by a growing number of individuals. There's a lack of confidence in vaccines, which is now considered a threat to the success of the vaccination program. Vaccine hesitancy is believed to be responsible for decreasing vaccine coverage and an increasing risk of vaccine preventable disease outbreaks and epidemics. Vaccine hesitancy is a relatively new term. It's used in research over the past few years to describe anyone who is doubtful about vaccinations and who chooses to delay or refuse immunizations even when they are readily available. So now I'm going to go into the first reason that I found. Reason one: vaccines can cause autism or behavioral problems, and this has been enhanced by stories in social media, and it's scaring the parents. Virtually every study involving humans or more than 10 participants or people who hadn't been convicted of fraud have shown that there's no link between vaccines and autisms. It was a valid concern in the early 90s, but after 30 years of research, there's 30 years worth of evidence showing that autism is no link to vaccinations. Um, like I said, the most commonly reported reason for parents for refusing one or more vaccines was uh, by other hearing stories from other people or hearing it from seeing it on social media. Stories in the popular media, such as social media and large scale news outlets, are often sensationalized to, I would say, elicit higher ratings and oftentimes spotlight a rare incident in which a child suffers a result of an unforeseen side effect of a vaccine. Which these are very, very um, minuscule. It does not happen a lot. Media that cite problems with components of vaccines, like thimerosal, and report that vaccines can cause autism, brain damage, or even behavior problems, cause parents to be more cautious and have more concerns regarding the safety of vaccines. Even though thimerosal has been removed from these vaccines for children that are intended 6 years or that are 6 years or younger, um, people are still not doing the research to find out that that has been removed. There have been accounts noting that these rare occurrences breed fear in the hearts and minds of parents who overestimate the dangers associated with vaccinations. Some fearful parents balk at the timing of immunizations. They feared that fear can influence some parents to choose to delay vaccines if their child does not receive more than one vaccine at a time. They fear that simultaneously administering multiple vaccines may overload their child's immune system, and they think that allowing all the vaccinations to occur according to the recommended schedule will make the safety risk greater. As a result of this logic, many choose to delay their vaccines in order to better protect their children. I know while some of them may view this as a missed opportunity, others believe that a delayed vaccination schedule is superior to not receiving vaccinations at all. I would guess I would kind of think that at least they're getting the vaccines, just being delayed, but still, it should probably be done before then. Many parents believe the side effects of vaccines are more extensive than what they're told by their physicians, and that the risks outweigh the benefits of vaccinating their children. Healthy relationships between a physician and a parent can go a long way towards helping patients in terms of this concern, and trust is paramount and will help put parents at ease and help them uh, overcome their fears. So having a good relationship with their doctors could be one way to uh, for to get the parents to know that their vaccines are safe. The second reason I found was people said there is not enough research done on vaccines at a given time, or the vaccines that we are given. Uh, Basically, this is a lie told by vaccine deniers to make parents scared. Vaccines are one of the most well researched interventions of all time. We have data from, I think, literally millions and millions of children across the world showing how safe that vaccines actually are. There's been more research on vaccines than almost any other medical intervention. The third reason, vaccines are extremely profitable. And what I mean for that is people are saying that we give vaccines just because it makes the pharmaceutical companies make so much money. And even if that was the case, why would we worry that the pharmaceutical companies are making money? If we've seen the research and we know that the benefits of vaccines outweigh the risks, what does it matter? Example I had wrote down is the international flower market is gigantic, but that doesn't make every bread ever a missive from the devil. Millers have actually been influential in protecting babies worldwide by fortifying their products with macronutrients and preventing neural tube defects. It's also untrue. Uh, pharma Pharma companies make far more money from so-called blockbuster drugs than vaccines. An example was Nexium. Despite being no more effective than the cheaper options for gastrointestinal problems, it has made more than $50 billion. The yearly earnings have been somewhere between 2 and 5 times as much as the flu vaccine. And another fact I found is that if you look at the top 20 earners of pharma companies, not one of them comes from a vaccine. The fourth reason, vaccines cost too much. They're too expensive. Um, I guess that's just who you're really talking to. I would think your life or your child's life would be more important than money. Vaccines don't really cost that much at all if you take into account. Example I put down was whooping cough. I think a whooping cough, the average for 3 doses was around $100. Yeah, for 3 doses, it was around $100, which I mean might sound expensive, but if you compare it to the cost of a single case of whooping cough can cost you nearly $10,000 if it required significant treatment. Vaccines are actually cost saving. For every dollar you spend on vaccines, you get about $7 back because you stop people from getting sick and dying from illnesses. Generally speaking, it would be much more profitable for the medical industry to not vaccinate because diseases tend to be really expensive. And the last one I found is vaccine injuries occur often and people are getting sicker and sicker. Um, Firstly, we aren't getting sicker, not even a little bit. Life expectancy is marching steadily upward, with some people predicting that we'll be living past 100 in this century. Not only that, but infant and child mortality is record lows and is only heading swiftly down. This isn't just true for wealthy countries. The entire world is getting stubbornly healthier. Secondly, vaccine injury. Um, Secondly, vaccine injury is an amazingly well researched field. We know the rate of injuries associated with vaccines all too well. It's roughly one serious problem for every million vaccinations given. This is a number that's been replicated worldwide from Japan to Australia to Finland and through the US. So that was the fifth reason that I found. These are my references, and Dr. Blair, I'm fine with you uploading this and using it for your library. Thank you so much. Have a great day.